headquarters and specifically from the offices of the Africa Centers for Disease Control and Prevention, with another edition of our Thursday morning briefings on the COVID-19 situation on the African continent. As usual, we'll start with a briefing from the Director of the Africa CDC, Dr. John Nkengasong, and then we'll move on to the question and answer section. And when we get to that, you can send in your questions to the WhatsApp number +251 94 550 2310. Let me give you that number again, +251 94 550-2310. Alternatively, you can ask your question live or utilize the question and answer section. My name is Wayne Musabayana. I'm Head of Communication at the African Union Commission, and it is my pleasure to hand you over now to the Director of the Africa Centers for Disease Control and Prevention, Dr. John Nkengasong. You have the floor.
Thank you. Thank you so much, Wayne. And good to see everybody on the platform as we do every Thursday. So as usual, I'll do three things. To give you an update on the epidemiological situation, and then discuss issues related to testing and what Africa CDC is currently doing to support member states, and then conclude with the situation with vaccines. So as of today, November 4th, a total of 8.5 million cases of COVID-19 have been reported across all 55 member states. Of that number, 218,000 deaths have been officially reported, and that represents a case fatality ratio of a rate of 2.6%. That number of deaths, that is the 218,000, represents 4.4% of the overall deaths reported globally. And as you are aware, we have just crossed the 5 million mark of the number of deaths worldwide, which is extremely unfortunate. If you look at the pandemic, again, which countries have gone through the third wave and fourth, as we speak, for the 6 member states have actually experienced the third wave, and that is that represents 74%. And one additional country, Niger, just joined that group of countries that have gone through the third wave. 7 countries are now experiencing the fourth wave. That includes Algeria, Benin, Egypt, Kenya, Mauritius, and Somalia and Tunisia, I beg your pardon. So if we look at the trends over I'll skip the variants this week because there's absolutely no movement in that direction. We still have 45 countries reporting the Alpha, 41 countries reporting the Beta, and 42 countries reporting the Delta variant. So not much have actually occurred there. But if you look at the trends over the last 1 week, that is between the epidemiological period 43, which is the period between 25th and 31st of October, and compare that with the period between 18th and 24th of October, we observe the following trends. First, the number of new cases as we speak today across the continent as of last week was 32,000 new cases, and that represents a slight increase of 1%. The highest proportion of new cases were from Northern Africa with 44%, and then East Africa with 17%, Southern Africa 16%, Central Africa 14%, and West Africa 9%. If we now look at the new deaths, a total of 1,277 new deaths were reported across the continent, compared to 1,300 from the previous week. And so this represents a 35% decrease in number of new deaths across all 55 member states. We'll now look at a 4-week interval, that is between the period of, we'll be very specific here, the period between the 4th and the 31st, okay, of October. And we observe a total of 16% average decrease 16% average decrease, with the regional trends as follows: 2% average decrease in Central Africa, 29%, average increase in Central Africa, 29% decrease in Southern Africa, 20% decrease in East Africa, 8% decrease in Northern Africa, and 6% decrease in Western Africa. So in terms of deaths, we recorded over the last 4 weeks a total average decrease of 16%. And the trends among some major countries include 27% average increase in Nigeria, 10% average increase in Egypt, a 100% decrease in DRC, 25% decrease in Ethiopia, 21% decrease in South Africa, and 9% average decrease in Kenya. In terms of testing as a continent, we have conducted a cumulative number of about 78 million tests, COVID tests, since the pandemic started. 2 million tests were conducted in the last week alone, and that is very, very encouraging. And we would like to understand how that surge in number of testing occurred. And we continue to see a high positivity rate, which is around 10.8%. In terms of capacity, Africa CDC continues to conduct trainings on genomic sequencing. As we speak, there's a group in Dakar, Senegal, at the Institut Pasteur, where we are training a large number of experts on genomic analysis from many countries. And I'm actually in Senegal. I'll be visiting them immediately after this press conference to see how that training is going on. And other trainings have been scheduled to take place in South Africa, or are actually taking place in South Africa as we speak. The Africa CDC successfully conducted a One Health conference the last 2 days, very, very successful, attended by thousands of people. So we are very pleased with that. And amidst this pandemic, we continue to carry out very important activities that are unifying the continent. In terms of vaccines access, a total of 278.7 million doses of vaccines have been delivered on the continent. Of that number, 196.7 million doses have been used. And again, that represents about 71% of total vaccines that have arrived and used. The coverage still remains low. Coverage in terms of people that have received 2 doses of vaccines is around 5.8% of the total population fully immunized. Some countries are making very good progress. Morocco is very, very close to 60%, to be very specific, 59.18% of the eligible population has been fully vaccinated. Egypt has fully vaccinated about 8.38% of its population. South Africa is making a very aggressive move with about 20% of the population vaccinated. Algeria, about 10.6% vaccinated, and Tunisia, also very encouraging to see the 29% vaccinated of the population, very specifically 29.88% of the population vaccinated. In terms of delivery, the AVA deliveries continue. In the past week, AVA delivered 1.178 million doses of J&J vaccines to 3 countries. That included Sao Tome and Principe, where they received 79,000 doses of vaccines. Nigeria received 624,000 doses of vaccines, and Togo 475,000 doses of vaccines. I really want to pause here to continue to applaud the efforts of those managing the logistics of this delivery for the AVA. Because for Nigeria, for example, there's 624,000 doses of vaccines, represents the equivalent of about 1.2 million doses of a double dose vaccine. So I think that is very, very encouraging news. And I think, as Mr. Masiwa has said before, we really are optimistic that our numbers will continue to increase in the month of November, this month of November. Really, really optimistic that we can begin to hopefully aim for the distribution of about 35 million doses by the end of November. So let me end there for now and return it to you, Wayne, to guide us through the question and answer series.
All right, thank you very much. That was Dr. John Nkengasong, who is the director of the Africa CDC. Colleagues, I want to remind you of the means through which you can send in your questions. So the first one would be the WhatsApp number +251 94 2310. Alternatively, you can come through to us live or utilize the question and answer section. Right now, I don't see any questions that are coming through to us. So colleagues, please, if you have any questions, feel free to use any one of those means of communication. Dr. John, I wonder if there is any extra advice that you might want to give to colleagues while we wait for questions. But as I'm speaking to you, we've just received a question, and this one is coming from, let me see. Okay. No, there isn't really a question. It's just a notice that our briefing today will last 45 minutes. So if there are any with questions, please make sure that you come through now. So let me say good morning to Duduzile Ramela, who wants to come through live. And Duduzile is with Newsroom Africa, based in South Africa. Good morning, Dudu.
Sorry, I just had to unmute. I hope you can hear me. Good morning, Ms.
I can hear you very well. Please go ahead.
Thank you, Ma. Good morning, Doctor, and thank you so much for the update. I do note a decrease in the number of infections and deaths in Southern Africa. South Africa has just gone through local government elections, and over the past 8 weeks, it was quite difficult for people to use non-pharmaceutical methods to avoid infection in terms of attending rallies and attending campaigning. I just wanted to know whether the CDC is concerned that post the elections, maybe the amount of infections will rise, and what your observation has been of the situation during electioneering here at home. I do know that some people are worried that we'll go into a harsher lockdown, where the country saw the harshest lockdown, on the continent. Thank you.
No, thank you. Let me just respond to that very broadly, based on our experience in dealing with this pandemic over the last close to 2 years. Amazing now, that each time we offer the virus a chance to spread, it will spread. I mean, period. We're dealing with the virus, especially the variant, the Delta variant that is all over the place, with the virus that transmits very quickly. And if you render the opportunity for the virus to spread, it will spread. At the same time, we've said on this platform that we have to balance between livelihoods, saving lives, and saving livelihoods. So we are not we are in a mode where we are looking for each country. We need to find that balance between where do they situate the measures that will be impunity for the population versus measures that will save lives. I think that is what we have to be playing with now. We have said that previously, that the days where very severe lockdowns, where the solution is over, we have to begin to balance between public health and social measures. How do we gather information that will enable us make informed decisions early on before we go into lockdown? Say, for example, what do I mean by this? If I were in South Africa now, what I would do is that you increase testing. Right? You just say, okay, elections were conducted, people were probably not respecting the basic public health measures, but let's increase the amount of testing. If you do that using the rapid antigen test, if you do that, you find the hotspots very early and you do something with them, rather than wait until those hotspots become wildfires and then we start going into big lockdowns. So that is the strategy that we will be advising the continent. In the coming weeks, we'll be launching a vast campaign of extensive testing of using the rapid antigen test across the continent. Our target will be that in the next close to 6 months, we should be able to test about 200,000 people using the rapid antigen test. The aim of that is to say that we are now at the trough of the peaks. If you look at what we usually go through the peaks, we go through the peaks, then it comes down. We are at the trough, and this is a period to do something, which is the do something means that we expand testing, expand vaccination as much as possible so that we don't need to go through the back to the peak. And then when we go to the peak, then we create extensive health damage and extensive economic damage.
All right, thank you very much, John. We have a question that's coming from Aaron Ross, and he is with Reuters. So Aaron says he's following up on an issue that was put forward last week, and that is concerning the price at which the African Union purchased the Moderna doses. So that's coming from Reuters.
Yeah, the price issue, I think, if you don't mind, send me a reminder email, please. And that way we can just send you that answer immediately by close of business today, so that it's as accurate. I did promise last week that we're going to reach out to Mr. Masiwa's group, who is our lead negotiator in that, and we want to be sure that we give you the accurate information, which we have not obtained, not because they don't want to, but I've been on the road. I'm in Dakar now, so it's been a little bit difficult to coordinate. But send it to me, please. My email, excuse me, you have my email address, or you send it to our communication people. They will send that to me, and we promise to give you the answer by close of business.
All right, thank you very much. So Aaron, please do send that email through. And if you don't have the email address, you can use that WhatsApp number that we give you from time to time on this program. So we move on now to a question that says the CDC, and that is the American CDC, recently announced eligibility for boosters for those who take Pfizer and Moderna at 6 months, and for Johnson & Johnson at 2 months. With Africa still in the race to acquire vaccines to reach the initial 40% and then 70% doses, does this in any way affect the level of immunity that we are looking to reach on the continent by creating a need for further vaccines? And I think that's coming from Wegata Minas, and Megata is a freelancer.
Yeah, I think that let's just go back to the US CDC guidelines that you mentioned. They were very clear that for those other vaccines, that is the messenger RNA vaccines, that boosters were recommended for a certain category of people that were immunosuppressed, and I think the elderly, but not for the general population. I think that is what that guidelines stated. Then with respect to Johnson & Johnson, they recommended a second dose 2 months later, which essentially is saying that the Johnson & Johnson vaccine should have been a double dose, not a single dose. But here is what we know about the Johnson & Johnson vaccine. The duration of immune response goes way even up to 8 months for that vaccine, and before it begins to wane. And if you look at, so 2 things I like to explain here. One is the duration of the immunity, which is the antibody levels, neutralizing antibodies, when do they decay? And then after the decay, what does that mean in terms of people who are exposed to infected if they are sick? So just bear with me for 1 second. So if you look at the Johnson & Johnson vaccine, single dose, if you immunize people with that vaccine, the immunity goes right up to about 8 months before, of course, all vaccines, they win, as you expect. I mean, the immune system that is the way immune system functions. But up to about 8 months or past 6 months, you still have high level of neutralizing antibodies for the single dose Johnson & Johnson. And high level means that it gives you way over 70% of those responses there. So the studies have shown that if you do an additional boosting at 2 months, it actually goes up to more than 90% there. But the key question from a clinical standpoint is that what does that mean? If it goes down to slightly after 6 months or 7 months, does that mean that if someone is immunized with the Johnson & Johnson and exposed, do you get sick or hospitalized? The answer is no, we don't see any difference based on the studies that have been published. So we at Africa CDC are putting together a guideline that will say that the priority is to immunize people first so that everybody gets their double shot as much as possible, that Johnson & Johnson, you get your Johnson & Johnson single dose, and then we'll gather more data, and then next year we use the data to make a decision. So it's like equity. We want as many people as possible to be protected than just a few people that have been vaccinated, then you keep boosting them up then. So that is not equity. So I think our position will be informed with the science that we are seeing, will be that yes, you can boost for those who are immunosuppressed, like the elderly, the HIV infected categories, but for the general population, younger people, people who have no comorbidities, we don't have any need for now to be concerned with that, given where we are. We are at 5.5% or 5.8% of the total population immunized. So if we start doing boosters of that 5%, we may never ever get to 60 to 70%.
All right, thank you. The next question is coming from Addis Getachew, and Addis says, how much has been spent on vaccine procurement so far? And could you please update us on the outcome of your communication with the European Union authorities on the latter's decision not to recognize vaccine certificates from Africa? And Addis is with Anadolu News Agency.
The vaccine, for questions with the pricing, please just contact the AVA coordination office. That is Mr. Masiwa's office. I mean, we don't deal with pricing at all. It's not like we don't want to share the information. I just don't have the accurate information to give you. They deal with the negotiations with the Afri-Exim Bank colleagues, so please reach out to them. Concerning the second part of the question that deals with
the European Union.
That situation, as you know, is evolving. So let me take it into two. You remember that the UK government initially said we're not recognizing vaccinations in Africa. I think they have since walked back from that situation, if you recall. So I think, and we issued a statement, a strong statement. We met with the Minister of Africa, and we have since we've seen that they have walked back from that situation. The European, of course, many countries, if you recall, had started recognizing a large number of countries very early on. Actually, about 19 of them were just saying, look, we recognize that, but we have not seen a common position as the EU. But we know that individual countries are recognizing the vaccines that we use in Africa. To be very specific, the AstraZeneca COVID-19.
All right, thank you. Let's go to Sarah Jerving, who is with DEVEX. And Sarah says, do you have any more specifics on either the Moderna or BioNTech manufacturing facilities in African nations?
We don't have any specifics. I will be in the next, the reason we are making this call short is that from here, I'm heading to the Pasteur Institute in Dakar, and I'm actually in Senegal. I'll be heading to the Pasteur to look at their facilities and also look at, visit the production site, the building, the physical building that the production will happen. And we are very pleased with the news last week in Rwanda. But we know that, and I have a call with the BioNTech group next week. We know that the target is to make sure everything is in place and start the production by mid next year. So that's what we know. You will, in the coming days, be invited to join an Africa CDC meeting, a conference or summit or a meeting that will happen at the end of this month, where we'll be discussing regulatory issues on the continent with respect to if these countries start producing the vaccines, how do we organize ourselves and for a regulatory as part of the AMA, the African Medicine Agency that that has been rectified as a treaty. So how do we work together with AU, NEPAD, the CFTA, that is the Continental Free Trade Area, as well as AMA and Africa CDC, to make sure that we have a regulatory framework in place that will enable us to stamp approval on those vaccines once they are produced in Senegal, Dakar, and other places.
All right, thank you, John. Judith Okolo, who is with the Kenya Broadcasting Corporation, that's Akolo, not Okolo. Morning, Judith. And Judith says that the decrease in infections has made people relax and perhaps only wear masks for the simple reason that they're going into urban areas and they fear being arrested by the police for not wearing masks. So she says, my question is, are we setting ourselves up for another onslaught of the infections? And also, what happens with the momentum to establish vaccine manufacturing centers in Africa if the public focus is on a reduction in infections and deaths? And hence, will this not lead to the belief that this is the end to the COVID-19 pandemic among the public?
No, Judith, that's a very good question. I know you are operating or reporting from Kenya, and Kenya has gone through the 4 waves. And you know that it usually takes between 2 months to 3 months between waves. So if you are down, what I call just with a crude analogy, if you are at the bottom of the valley now, which many countries are now at the bottom of the valley, expect that in 2 to 3 months, it will come back up, okay? Just because of the reasons you stated, Judith, because people are more relaxed. They don't see people dying. They assume they lower their guards, and because of that, the virus spreads quickly. That's why this is the moment to do 2 key things, and this is my strong appeal to countries. Do the testing, surveillance at this point, so that you can pick the hotspots very early on and squash them. If you look at the map of this, the peaks and the troughs, it usually goes flat for a while, and then when it comes up very quickly. Okay, it means that there was spots of hotspots going on and nobody knew about it. And the only way to find those hotspots is to expand the rapid test at the community level and find those hotspots, do something with it. I think that is one. That way we avoid locking down the economies there. Second is vaccination. The time people who have not been vaccinated and there are vaccines out there, you go out and get vaccines so that when the 4th wave or the 5th wave arrives, your immune system is armed. You don't vaccinate today and expect to be protected tomorrow. I mean, these vaccines usually take a few weeks to actually give you the right protection. So I think this is the right time. Appeal to countries is that expand your vaccination now that we are experiencing the lower transmissions. Expand your testing now so that we can completely blunt the arrival of they call it the 4th wave or the 5th wave. And with respect to vaccine manufacturing, I'm very encouraged that we can give you an update of this subsequently. Through the African Vaccine Partnership for African Vaccine Manufacturing, PAM, there are now about 15 countries that have expressed an interest in vaccine manufacturing. Okay, and there's really a lot of countries there, and some leading countries, South Africa, Rwanda, Senegal, and you also have Kenya just joined. And so we are very encouraged with that. But what we are saying is that let's do that in a coordinated fashion. Let's do that in an ecosystem so that everybody understands where in the ecosystem of vaccine manufacturing you want to sit. Let's also do that and shape the market so that we know that if you produce vaccines, there will be a market for the vaccines there. So we are very encouraged. It's a good problem to have, a good problem that many countries want to manufacture vaccines. And it would have been a terrible problem if no country in Africa was interested in vaccine manufacturing.
All right, thank you for that. Lucia Blanco from the International Spanish News Agency says, my question is about the Ebola outbreak in the DRC. Is there any update or new information that you have? And also, what are the lessons that have been learned from previous experiences and are being implemented now? And then finally, she asks, is the outbreak under control at the moment?
So as of this week, we have less than 10 cases in that country, but unfortunately with a very high mortality. As usual, the case fatality rate for Ebola is very high. And the beauty with this outbreak is that most people in that region have been vaccinated, okay, from previous outbreaks, okay, so what we call ring vaccination. So we believe that the reason we are not seeing an escalation is that many people had already been vaccinated previously. Remember last year we were in that region for about 2 years. So I think we continue to keep our fingers crossed that the pandemic, the outbreak stays very limited. So we are optimistic. We have people in the theater of response. Within 3 days, we were able to put people in the theater of that response. And since we have responders in Congo already. So that's all we know for now. So in terms of previous experience, yes, the vaccines are out there. Cooperation with the community has been critical. That's why many people were able to be vaccinated and continue to be vaccinated now by the World Health Organization.
Thank you. We go now to Gemma, who's writing from Media Hack. And Gemma says, does the Africa CDC know whether Eritrea will start vaccinating against COVID-19? And if not, what is the reason for not vaccinating?
Eritrea, we continue to engage with Eritrea, but I remain optimistic. And this is a very an honest answer. You remember just a few months ago, there were 3 countries that we told you we were going to engage with them. It was Tanzania, Burundi, and Eritrea. I went to Tanzania and met with the head of state, and the situation has since changed. Burundi, we've engaged with them, and they are now buying vaccines through Harvard, and they also have received vaccines from COVAX. So, I mean, we have 1 more to go, and we are not giving up until all of Africa is engaged in this fight against COVID-19. If it means going to Eritrea to meet with the highest leadership, we will go there and meet with the highest leadership, because there's no way that we are going to get rid of COVID across the continent without engaging all countries and without all countries taking their own responsibility to vaccinate to up to 70% of the population.
Okay, let's go back to Judith Akolo, who is with Kenya Broadcasting Corporation, and she has a follow-up question. She says, now that Dr. Nkenga Song says that the immunosuppressed people and those that are elderly may need a booster jab, what happens to those that got their first shot in May, for instance, in Kenya? Would they need to get the booster shot in January, for example?
If you got your first shot in May, then you don't need to wait until, if I understand the question right, you don't need to wait until January to get your second shot. I think usually it's about 4 weeks, 6 weeks to 8 weeks interval between the first shot and the second shot to complete the dosing there. So I think there's we should not confuse booster, which is the 3rd dose boosting, versus a second dose, which is just the process of full immunization. I think full immunization for vaccines that are 2 doses I don't call that a booster. Those are complete immunization. A booster, a 3rd dose booster will be where you receive your 2 doses of vaccines within, say, a period of an interval of 6 weeks. And then after 6 months or 8 months, you are eligible to take a third vaccine. So I think that is what it is. So if the people have received their first dose of any type of vaccine, with the exception of Johnson & Johnson, because it's a single dose vaccine, then they should try to respect the interval, which usually is between 4 weeks to 6 weeks to 8 weeks, depending on the vaccine, so that they can get their second dose of the vaccine. I don't know, Judith, if I answer your question.
In fact, Judith has just come through again to say she was asking about the booster dose, i.e. the 3rd dose. Oh,
the 3rd dose, of course, conservatively, and there's really Judith, no exact data to say that you should do it at 6 months or you should do it at 8 months. But I would say that based on the between 6 months to 8 months, you should get that. For those who are immunocompromised and the elderly in Africa, please, I just want this to be very clear that it doesn't go on the record that I'm recommending booster for everybody. Absolutely not the case for now. And we'll be issuing guidelines to that effect.
All right, thank you. Just for the information of those who are asking for the WhatsApp number, let me repeat it again. And it is +251 94 550 2310. +251 94 550 2310. I believe we have another question that's coming in from Sarah Jerving. I think this is a follow-up question. And she says, how are communities responding to the DRC Ebola response? Have you seen any resistance with any of your response efforts? And do you know what percentage of people in that area are vaccinated? And finally, how long does the vaccination protection last? And that is in regards to Ebola.
Yeah, very good question. So A, we have not seen any resistance in that area with respect to Ebola response efforts. Remember, this is a region that is already, from a point of view of sociology and anthropology, already aware of Ebola and the efforts that go in there. So it's not, this is nothing new to them. Community trust has been established over the last couple of outbreaks that we have been in that region. In terms of percentage vaccination, I truly don't know the exact number, but that is a very good question that I would like to let my team team in the field investigate, and we can take up that question offline and provide you with answer, as well as the duration of immunity. I know that unlike the vaccines for COVID, the vaccines for Ebola really have a long-lasting immunity, but how long, I really don't know, but it will be good to go back. Remember, these vaccines just came online just about three years ago. So, and many they came online in West Africa, and they used in DRC fairly in the last 2 or 3 years. So we still have to see over a long period of time if the immunity, how long the immunity stays, and that will be based on prospective studies to find that out. So I think no one can actually give a specific answer with that, but that is truly an area of active investigation.
All right, thank you, John. We have a question that's coming in from Andrew Meldrum, who is with Associated Press. He has a number. So first he says, what is the outlook for vaccinations by the end of this year? Secondly, are vaccine doses arriving and being administered at a rate that Africa could achieve a vaccination rate of 10% by the end of this year? So those are the two questions coming from Andrew.
Yeah, Andrew, very good question. I think our projection, as Mr. Masiwa will tell you, will confirm, is that we are hoping that by the end of the year, AVAD, let me start with AVAD, can distribute up to about 35 million doses cumulatively. So I think we are at probably around 12 million, and we expect to see distribution scale up based on the contracts to get to the 35 million. And we are also hopeful that COVAX deliveries will also come in so that the COVAX and AVAD deliveries add up to that, enable the countries to get to the right percentage by the end of the year. All of us, our hope and wish is that by the end of the year, at least 40% of the population would have been vaccinated. But again, remember where we are. We are at 5% today, or 5.5%, so that is an uphill task to get there. Vaccines that are coming in country being used, yes, the rate of administration varies. I mean, Africa is not a country, so you have to unpack them and see some of those countries that are listed here, the likes of Morocco, Rwanda. Rwanda has administered 25% of its vaccines of the eligible population, and their target is to get to 40%. And because of that kind of remarkable progress, we are making, we just issued a statement, I think 2 days ago, making Rwanda and Morocco two of our centers of excellence for vaccination. And what does that mean? It means that we'll be bringing in people from different countries to those kind of centers. In Morocco, it will be the Pasteur Institute in Casablanca, and in Rwanda, it will be the Rwanda Biomedical Center. Because of the speed, the organization, and the logistics that they have put in place, I think they offered an opportunity for learning so that our other countries can learn how to vaccinate at scale. So I think the point I'm making is that it's not a uniform statement that I can make. There are countries that are on the very fast track, accelerated pathway to getting to 70%. There are countries that are in the middle. You see the South Africa is around 20%, and we continue to see the numbers increase. And then on the lower side, there are other countries that are really still struggling to come up to speed. So it's a question of balancing out. We at Africa CDC, through the partnership with the MasterCard Foundation, will be scaling up the support to countries. In November, end of November, about 20 countries will be in Morocco as part of the center, the Center of Excellence approach that we are adopting to learn their experience and also begin to share experiences amongst countries and work with implementing partners that we have identified. So we believe that with that kind of effort, it will catalyze the uptake of vaccines there. So we'll keep you informed as we move forward. Then early December, we'll be in Rwanda with another set of countries so that they can learn from the Rwanda experience and exchange information. I think we're using all kinds of innovative ways to keep moving until we get to 70%.
Thank you very much, John. Before we get to your final headline points, Aaron Ross from Reuters has just come through to ask if you could kindly provide the right contact at AVAT.
Yes, we will. If you send us your contacts, we'll send you at least our contacts at both AVAT and the Afri-Exim Bank, so that you can reach out to them more directly. So send us your email. Email is the best because we'll send that to them and then copy you, and you can get connected very quickly. WhatsApp at times is difficult for me to maneuver with that, but if you send that to our communication people to Win, they would make sure that I get it.
All right, okay. So I'd like to ask Neke to please provide that email address to Aaron online so that he can make that follow-up. But for now, it's time for us
if Neke can just type that on the chat box, that will be very helpful. That way we tick that box in terms of an action item that has been done.
Yes, thank you very much. So now it's time for us to hear your summary of the main points as takeaways from the briefing today.
The key point, and only one point to take away from the briefing today, is that we are very pleased to see where we are with the pandemic in terms of the continuous reduction, decrease in number of infections. We are at the trough of if I can use that analogy of valley. So there are two things that I'm appealing for the continent to do: is scale up testing, scale up vaccination. As vaccines come in, use it. The communities, we should engage the communities. It's doable. We have seen what the likes of Rwanda, the likes of Senegal, Ghana, Togo, and others can do. I mean, Morocco is close to 60% there. So if we vaccinate now intensely, then we can anticipate and actually blunt the next wave arriving there. If we test now massively, we'll find the hotspots and we can do something with it before it comes back, it flares back again, because it's a question of time. I've said the period between one wave and another is between 2 months to 3 months. So there is no doubt that there will be another wave. But now we have the tools in our hands. Let's use the tools. The two key tools we have in our hands is the antigen test. let's put it in the hands of the community and then the vaccines that are coming in. Thank you.
All right, thank you very much. That was Dr. John Nkengasong, the Director of the Africa Centers for Disease Control and Prevention. Before we sign off, Aaron, let me just alert you to the fact that Nekeron has sent 2 email addresses through the chat. So please make use of those for your follow-up questions. Time for me now to say goodbye to you, colleagues, and to thank you very much for having been with us for the past 45 minutes, and say to you, let's meet again next week on Thursday at the same time. From everyone here, have a great week.
Thank you. Thank you.
Recording stopped.